The old hound ain't playing around. Multiple vaccine projects have been paused by the Department of Health and Human Services Secretary Robert F. Kennedy Jr. Kennedy paused a multi-million-dollar project to create a new COVID-19 vaccine in pill form on Tuesday, and the Food and Drug Administration canceled an advisory committee meeting on updating next season's flu vaccine, an advisory committee said Wednesday. The COVID project was a $460 million contract with Vaxart to develop a new COVID vaccine in pill form, with 10,000 people scheduled to begin clinical trials on Monday. Of that, $240 million was reportedly already authorized for the preliminary study. Meanwhile, the FDA's Vaccines and Related Biological Products Advisory Committee, or VRBPAC, was scheduled to meet in March to discuss the strains that would be included in next season's flu shot. But federal officials told the committee in an email Wednesday that the meeting was canceled, said committee member Dr. Paul Offit, director of the Vaccine Education Center at Children's Hospital of Philadelphia. In an email to NBC, Norman Baylor, a former director of the FDA's Office of Vaccine Research and Review, said, "I'm quite shocked. As you know, the VRBPAC is critical for making the decision on strain selection for the next influenza vaccine season. Last week, an upcoming CDC Vaccine Advisory Committee was also postponed. These moves send a disturbing message that Kennedy's anti-vaccine views are starting to influence health policy." On Wednesday, the secretary already had an alarming, nonchalant response to the first American measles death in a decade. Now it seems American public health efforts could experience a serious setback as long as President Trump and Kennedy are in government.